Um, I want to welcome the panelists to this conversation. And in the program, we seem to have put a lot of time for the panel. I don't know how much we will be able to, but we will definitely have a panel discussion because we are extremely proud that the three of you who are now really crunched together in the sofa. Yes, I know, you look happy, all of you. And of course, our wonderful host, Cliff, can be with us now and have this talk. What I would like to do now, very briefly present the panelists, and then I will ask each and one of them to say a little bit about their own organizations, because they're working in different contexts and working with this subject matter in a very systematic and fine way. So I want you to present that briefly, and also then, even in that presentation, start talking about how can we ensure that we can reach to those that we want to work with. Because as we have spoken today, the main ambition of our work is to reach helpers, those who are out there in the front line, who are meeting survivors, meeting people who are on the run, who are finding themselves in situations of emergency, finding shelters, place to protect themselves, and in situations where it may be extremely difficult to go to any more regular systematic help. They need support, they need help, and they need understanding where they are and where they need. So we need to support the helpers. So if you can reflect a little bit also about how can we reach out with our message when we speak about awareness and also skills and tools to help psychological first aid and all of these terms that we have. Well, having said this, I want to say first of all, welcome Shahrullah Dahog. You have come from UK this afternoon. You are the director of All Survivors Project. You have been working for a long time in different places on these subjects. Now you have in particular lifted the gender issue on sexual violence against boys and men. We met each other some months ago, and we just found that we must keep together. We have a lot in common, and you have inspired our work enormously. Thank you very much. And you, Maria Carolina Asa, you come from Geneva also today. You work, as you were introduced, at the International Committee for Red Cross, and you also have been working for many years in different places, including occupied places in Palestine. You have worked with sexual violence and especially also against boys and men, and you already shared with us the report and the findings. So thank you very much for this. And Cliff Mustache, you are such a fine person, and I want to say that we're so proud to be with you. You are challenging the world in many ways by using art as a way of communicating, as a way of reaching out. And you have done that in a way in Norway that you have established this place, and you have prizes, and you have upcoming prizes, and this is really because you have used the speech and also alternative ways of communicating against racism, against poverty, against social injustice. And I know that you were very also interested in spreading information about sexual violence also of groups where we normally don't think about it. So again, thank you. We're very proud to have you with us. Kelly Fisher, you're working with Reform, which is the Norwegian-based institution or NGO, and you have as a very strong focus on violence against men and men's rights in more general. You organized a panel this summer in Arendal's Week, which is something very famous in this room for those of them. And that was on the invisible men in war. And when I say that title, people say, what's that about? And then I start thinking, and then, yes, of course, but I never thought about it before. You have done this, Reform is doing a great job. Helen, I think I won't use time now to introduce you. I could go on for a long time. We have collaborated for years. We have traveled around. We've tried to do the little we can, against injustice and against violations. So I would like to start with you, Sharu, to speak a little bit about Reform. Excuse me. I'll leave that to Kelly. To All Survivors Project and the special focus of this evening. So the floor is yours for 5 minutes at the most, also with some ideas about how do we reach stakeholders.
Thank you so much, Nora, and thank you to all colleagues who have invited me here. It's a very special space for us as All Survivors Project to be here, because it's very seldom that you find people who think alike, feel with compassion, and come together from different walks of life. Before I start to introduce the work of All Survivors Project, I think I speak for all the organizers and indeed the participants that this is a safe space. I understand that a lot of conversations that have happened today could be traumatic, could be triggering for all of you, and some of you in particular. And I hope that this is a space where you don't feel traumatized and there are experts at hand to support you, indeed, if you do. So All Survivors Project was born about 7 years back and was born as a result of my work on human rights, particularly in the context of Sri Lanka, where 35 of the people I interviewed for a report for Human Rights Watch were men. I have no doubt that I traumatized them in my interview. I was certainly very traumatized by it. I had no experience of interviewing and working with male survivors of sexual violence. So All Survivors Project was born to set this right, to do things properly, appropriately, safely, and in the human rights framework. So we are a human rights organization, we are feminist informed, and we work in an intersectional manner. We work on three main pillars. One is access to health. Second is access to justice. The two go hand in hand. And the third is on prevention. By prevention, we don't work within communities, which is very needed, very important, essential work. But we work in building up the human rights framework, informing human rights mechanisms to take into account that sexual and gender-based violence is gendered in the very way it's inflicted. The fact that sexual violence happens against men and boys happens because they're men, because it is a tool to coerce, bully, empower, and control. It happens in a widespread manner across society, in all societies. It happens in the UK, in the context of football, in the context of the Catholic Church. It happens globally. It happens in the context of detention settings in the US, which has reported some of the highest levels of sexual violence against LGBTI populations. But in conflict, it becomes a particular tool, a tool that is very hard to really address because, as has been pointed out throughout today, disclosures are very low. Men and boys don't speak. They don't speak because they fear stigma, they fear they will not be believed, and also, in a lot of cases, boys do not speak because they know the abuse is inflicted against them because it buys silence. So what can we do, Nora, to really reach these populations in humanitarian settings? One of the things that's emerging very starkly in our work in Afghanistan, in Central African Republic, in Colombia, in Syria and Turkey, and now in Nigeria, is that there is a lack of understanding. There is a lack of, so there are gaps on many levels. There is an information gap. There is an analysis gap. There is a gap in terms of monitoring, reporting. There is a gap in terms of what do we do now? The title of most of our reports is from the voices of the men who've been affected. And the main thing they say is, we do not know where to go. So the fact that humanitarian responders cannot respond to them, the men don't know where to seek access to services, is one of the main issues that needs to be addressed. And how do we go about addressing this? There is no shortcut to informing communities, to really scaling up sensitization on this issue. But I think my colleague Kelly would be talking more about that. But from our perspective, health and justice go hand in hand. access to health is access to justice, and let's not forget that. Thank you.
So the lack of justice may be traumatizing for people. Thank you very much. Chair, I think you summarized a lot of important things. We'll come back to them. So I think I'd like to ask you also now, Kelly, can you say a little bit about reform and also fill in where our challenges are with reaching helpers and supporters?
Yeah, thanks. And I just have to say first, it's really an honor to be on the stage with everybody here. It's everything from when I first heard about this handbook and I saw it and read through it, it's such an important contribution, especially someone who has also worked on the front lines when I worked on the US-Mexico border. This is the type of resource that when I look back is definitely something I needed. And also the report that Maria presented about. When I saw it, I sent it to many of my colleagues. I said, you don't just put this in your download folder and read it later, you have to read this. It's really groundbreaking. Also, Cliff, for all of you, we were fortunate to see an excerpt of that show tonight. I saw the whole performance last year and it's quite powerful. Shadow, we've connected already quite a bit about All Survives Project. I'm excited to follow along more. So yes, lots of thank yous here. I feel like now I'm in the Oscars all of a sudden. It wasn't my intention. But yes, so I work at Reform. For those of you who aren't familiar with it, it's one of 4 gender equality centers here in Oslo that's specifically working with men and boys on topics relating to masculinity and gender equality. We work on a broad array of different topics. This includes everything from working with men and boys on mental health, because as we know that they're overrepresented in taking their own lives and less likely to seek out mental health help, but also working with men and boys who are victims of sexual violence. And we have been working on this topic for quite a while, specifically in Norway. We had a report a couple of years ago called Ser vi gutta, or Do We See the Boys? Where we specifically looked at this within the Norwegian context. And I highlight because it's also important to acknowledge that this is not just something that's happening elsewhere in the world, it also happens here in Norway. And one of the things that we highlight is that that's probably around 10% of all men and boys at some point in their life in Norway will experience sexual violence. It's something that we kind of concluded from our report and talking to lots of different experts and lots of literature reviews. And of course, this is not as prevalent as with women and girls, but it is much more prevalent than a lot of people expect. And also that men and boys are much less likely to receive the help or the need that they need when they're seeking it out, as we've also heard from different presentations tonight. I think one of the things that we are working a lot with and how we think about this, it's really important, and I kind of acknowledge this and kind of say this because of everyone that's here tonight, is that we have people here from many different working backgrounds, whether that's from different ministries, from different NGOs, from students here who will probably be working in lots of different relevant things. And one of the things that's really important we do is how do we nuance and rethink about men and boys as vulnerable. And I think that's something that every day that if you probably listen to the news or if you look at the newspaper and you read about a humanitarian situation, that you will often see women and children. And I think that it's important that we actually kind of problematize that statement because it kind of assumes that men can't be vulnerable and also just assumes that women can only be vulnerable and passive victims. And I think this is something that both a lot of feminist researchers and activists have fought against to say that women are not only just passive victims in war and conflicts, that they are also agents of change, that they take action, but then we also haven't done the same nuancing about boys in war and conflicts, I would argue. And this has important implications. There's a really important study that was done by a researcher here at the University of Oslo named Anne-Katrine Kraft. And she did a survey asking people if you had to assume what percentage of men or women die in a conflict, that many people underestimated how many men die in a conflict, specifically civilian men. And just an example that in the Syrian war, that about 90% of all civilians who died were men, which for a lot of people was quite a shocking statistic to hear. And that when they surveyed people and when they found out about that it kind of changed how they perceived men as also vulnerable and also changed perceptions about how we think about For example, refugee policies, or who do we take in? So I kind of say this in terms of how do we support those who are working on the front lines. I think I just say this here that it's really important that we also ourselves are nuancing our understandings of men and boys' vulnerabilities. I realize people who are already here are interested in this topic, but how we go about in our different workplaces and interact with people. Yes.
So your strategy is very much really opening up eyes and making people aware of things that in one way should be obvious, but it's not. So, and I remember when we spoke last time, I came up with the concept masculine vulnerability. All of a sudden there was research on masculine vulnerability. Was that necessary? And obviously it was. Yeah.
So I think that's just like, I could talk a lot longer, but I want to So I'm kind of focusing on the awareness raising here or there, but if there's more time, I'll speak to more later.
It's very inspiring, and I think this awareness raising and bringing up subjects which are often put aside is something that you know so well also, Cliff. So can you say some words about this place and about your, I would say, almost mandate in the Norwegian society and what you do to touch hearts and to change minds?
Yeah, I think first and foremost, it's just we just feel that we want to be part of something, of a society. We need also to feel that you belong to something, belong somewhere. And I think that's all also brings the focus that, okay, this is where I belong, that's where I have to contribute. So for us, the Nordic Black Theatre, that's, I think, when we felt being apart and not belonging to where we lived, then we decided to take the matter in our hands and look at the future generation coming here to in 20 years' time and say they need to feel they belong somewhere instead of not belonging. So that was a primary sort of goal we took. And I think that was also a much, even you have that vision, it was also a learning process as you go along. Because you're meeting people from all walks of life, cultures, backgrounds, and all of that. But one thing is in common is the narrative that we have to share, to tell with others. And that's the thing that probably had made us that place we are today. But I'm just going to say a little thing about the process. To me, I think art is in a way, its own narratives of language, its own way of expressing the sentiment, the story. And when I was contacted by Elizabeth, Nora, and Monica, and then understood, I mean, I consciously know about these things are going on, but suddenly it also helped me to realize that there's so many things happening in the society and we're not able to relate, to share. And that was the first things that set my focus for that work, which your group and all that. It was quite inspiring, it was very hard. And by the way, and I thought about my community the men in my community need to share those stories. It was very hard, because they have a kind of distance from that. And now they have to go on stage and really transform that thing. And that was a hell of a process to convince themselves. Because I said to you, I don't want you to play theater. This is a documentary. This is life. This is reality. And thanks, we have a meeting with you to help them to discuss the process further on. And for me, it was a learning process, total. And I think that it benefits myself and my humanity by being able to share those sort of stories if I ever get a chance, because I thought about it is so vitally important. Because we heard story about, we all know through the society we come up about sexual violence against women. And we think it never happened to us. But we don't talk about it. It's a taboo. Even if it happened, we don't talk about it. And suddenly we are men talking about it and sharing it together. That was, I think it was a very impressive and inspiring journey to take. And I think we're looking forward to see that. You know, you give me the microphone, so I will talk. But I think I've seen it that these things should not be finished in a book, and literatures, in academics, papers, but it's also we should find a way to how we bring it to the school. We talk, presentations, and then have talk with the children, the young people, because a lot of them, they close the emotion, even they go into that, and they don't want to talk about it, because if not, if you talk about it, there will be more. Nobody will believe in them. So being there in classroom and have 15, 20 minutes of documentary film on that, and then open up for talk. And I think that also can give education for the coming generation, the younger people too. Yeah.
No, it's very interesting what you're saying, because now we had the Yael, who was doing the fantastic presentation today, and last year we had 2 actors, and we felt that there was a threshold, or that something that had to be overcome in order to take this on and really being it. And of course, what we saw today, also Vael, he was there in the room. He was the man who had been pressed and had been exposed to this violation. And I know that it took its toll to do that. But that being said, the message is so real, and it gets us. So that's.
Sorry, because when they've done that, he told me I have to go home and take a shower.
Yeah.
I have to clean myself before I go, and I have to go to the mosque after, and then I can eat. You know, it's the process of that, and I think we told him, you know, what it has done to him is a new awareness, because it was difficult to get him to do the role in the beginning because of the taboos of thinking and all that. Now he's enjoying it. He feels it is important to tell such story.
And this is really the message that we need to take out. So Maria, I want to continue with you, and thank you very much. I want to continue with you. You said a little bit about your work, but I think it would be very nice if you could add a little bit to it, and also when you have been to the different places working on these subjects, how have you managed to reach out, and how can you be heard, and how can they use what you try to communicate?
Yeah, thanks so much, Nura. So just to reiterate, I work at the ICRC. We're an international humanitarian organization that protects and assists people affected by armed conflict and other situations of violence. And oftentimes it's forgotten that in addition to protecting and assisting, we also try to prevent further harm. And I think that's something that I really want to stress on when it comes to sexual violence. When we speak to survivors in our work, often what comes across is not only did they experience the first violation with the moment of assault, but often disclosing is the second violation. And with every layer, it could be the third, the fourth, the fifth. And so really what we try to work on when we're working with communities is to see how we can first reduce the barriers to access and also reduce the likelihood that there is that secondary, tertiary violation. I think one of the ways in which we do that, so it's not just us as ICRC, we have many partners across this international movement of Red Cross, Red Crescent societies. Norwegian Red Cross is one of them. And often when we're working in communities, we're working with what we call the national societies. So the South Sudanese Red Cross or the Ethiopian Red Cross, and many of them are volunteers who are also affected by conflict. And recently what we've been trying to do is, based on local knowledge, understanding how people talk about sexual violence, how people experience sexual violence, and then trying to take the community's knowledge and build on that to see how we can facilitate leaders to influence positive behavior change. So how can survivors coming forward be better supported? How can they be encouraged in their help-seeking behavior? And really, what are the means to do so? That's one of the ways that we work across the movement, and we hope to continue doing so because it is the strength of our response.
I think what you're highlighting is the need also to approach survivors in different ways. Helen spoke about the problem of asking directly, and sometimes we should not ask directly, but there's a lot of messages that can come across even if we don't ask it, and practically and indirectly force people to speak about something that they feel as being the unspeakable. And you just said that to being forced to narrate something when the time is not right, maybe just another trauma. So that's why we have in those 3 manuals developed the strength or the ways of speaking in an indirect, empathic and supportive way, but without saying, I can do nothing if you don't tell all. And again, we have to make a difference between when do you have to talk to obtain justice, but then the focus is different. And when do you have to talk to get help? And sometimes you don't need to talk so much to get help. And we should really clearly also discriminate between when you talk to get justice and when you talk to get help. These are 2 very important things. They should never be mixed. But so thank you very much for this. I'd like to say, Helen, I'm asking people how can they reach those who are out in the field. And I want to go directly to that because right now I know that you are having some intense webinars with Ukraine, and you do this with our good colleague Anna, who is sitting right here,
who has translated the whole manual,
the child manual already to Ukraine. So there she is in there. You are actually now practically not on a daily basis, but almost. You have contact with people working on the ground in Ukraine, and you're there supporting them, talking to them, providing both material from the child manual, but also from your vast experience as a child psychologist working in places of emergency. Can you say some words about how you're trying to reach out right now and what you think is happening with those who are, as we speak, working in such a dismal and dangerous situation?
Yeah, I think that in the Ukraine, when we did the webinar in Ukraine, it was, I don't really know, Anna, the participants was from a humanitarian organization, yes, it was. But we also work with the NRC, yeah, because they have a lot of employed people in,
Norwegian Refugee
yeah.
Council.
And but excuse me, I also had an association to CLIF because I think also we cooperate with humanitarian organizations, but I think also that working with teachers or preschool teachers and working with those who meet all children are very important, both for so that children can recognize that and be able to talk to someone. So that's also one arena I think it's important to reach out to, and also to parents actually, because when we gather all these cases, these 12 cases that is in the manual, in many cases the child tried to tell and wasn't believed. So, and also in the family, because sometimes the perpetrator is a relative, so telling about it is a sort of shameful for the family, and many times the child is accused of being the guilty one. In Nepal, we were told that if there was an incest, that the father abused the child, then the father and the child are the perpetrators and the mother is the victim. So, we really also need to work on very different levels, both in schools but also with family guidance. So in Nepal, we also try to include we have done a parent guidance intervention, and we tried also to include how to treat the child, how to receive a child if the child has been abused, how to meet the child. So I think we really have to think about very different arenas where we should be reaching out, not only to caregivers, and also in Nepal it was the seven organization that was a social organization working with in child protection. So it's many different, I think, arenas that we have to address.
And yes, I was mentioning that you work now very actively with Ukraine, but you have in the past, not so of this past, worked with Gaza and helpers in Gaza. So of course, the only saying that reminds us of the dreadful situation in that region for children and well, for everybody. But thank you. How are we on time, Monica? Because I do have one more question to the panel.
You have time to one question.
One question, one. Because we have looked at, we have explored a little bit how can we reach out and ensure that that what we try to communicate is reached and perhaps even found useful. And I think one of the things that we've tried to do, but which is always very difficult, is to try to follow up after having had some webinars or some conversations or even in live training, to have follow-up afterwards, because we know that teaching and training is very inspirational when you're there, but it takes some time to change the ways of doing things. So we always need to follow up and ask them, how can this be used? Is this helpful? And also it's a way of supporting those who are in the field, which is often a very stressful situation. So I think you have illustrated these situations very well. But what are the obstacles that we're facing? How can we, what are the worst challenges that we're seeing right now in our work? Because we work on a human rights basis, and I usually say that if you're going to work with human rights, you have to be optimistic, because if not, you just stop working with it. You have to feel that it's useful what you do. But yes, we do find obstacles and hindrances and things that make our work different. And we're trying to reach out with psychosocial support to people who have been exposed to serious violations in war and conflict and in other peacetime as well, of course. What are we facing? You want to start it?
Yeah, I think it's a big challenge, especially in our community. How can you convince them that these stories are true? I think there's so many taboos, and it's just like we can't fight them, we just have to win them. So we have to find a way to approach them. So in that long run, we'll be able to convince them. I think the community is very vital, especially where a community is dominated by men. And because a man will, in certain communities, be wrong, some men will never want to open up for a narrative on the subject. So we men ourselves, we have responsibility. So we have to enforce that those narratives is also shared between men, first and foremost. And I think when you get the men with us, then I think slowly we can get a better understanding with the child and mother. I think the men are vital, first and foremost, because they are the one that has, I think they were the one who has suppressed the situation. So they don't want to accept it, they don't want to talk about it, they're locked up, and they bring religion as an excuse, which is also important to understand the sentiment, but they want to have a way to open dialogues with them. Because the symptom is there, it's just growing more and more. So I think we have a very big challenge within our own community. That's what I see. And I think in that situation that we did the play, we bring one guy who is Muslim and one other one who is different, and how we talk between them together. First, it was difficult for them to accept, even it was a play. They wanted to do acting, but then you have to talk about the fact. This is a consciousness. You have to be very ensure that you are going deeply, truly, to tell such story. And you can only tell if you believe in it. So, these are the things that we got to, this is the way we work together to make that happen. And I think this is still a very big struggle, it's a very, very big sort of work to be done there, especially in a local community in Oslo. That's why I know very much, yes.
Thank you, thank you very much. Charlotte, do you want to add what you find in your work? Because you're actually situated in different places, not only in the UK, you're in Liechtenstein, yeah, another place. But in your work, what do you find, what are the barriers, what are the mountains to climb?
I think the other side of the problem that you painted, Chris, the community and individual attitudes are social norms which are dictated by law, policy, and the government. So if you have a country which does not criminalize sexual violence against men and boys, as in the legal framework is not gender inclusive, you have a country where health policies are gender exclusive. The sexual violence protocol in Colombia is gender exclusive. This is a Ministry of Health document. In Sri Lanka, sexual violence against boys under the age of 12 is not criminalized. These are important barriers. If you don't have the framework, you are not informed about it. And then I think there's another responsibility. The other responsibility in terms of barriers is the funding gap. Because sexual and gender-based violence remains chronically underfunded in these contexts. And in these contexts, you end up with humanitarians fighting over a very small cake. So you have the contestation, constant contestation, the need for numbers. Okay, where are the men? Where are the boys? Why should we program for them? We don't have the funding. And again, coming back to the point that you made, Chris, about community attitudes. In Central African Republic, thanks to the support of our Norwegian partners here, we did a study last year, a very small exploratory study with community-based organizations regarding reintegration of children who are associated with armed forces and armed groups. 100% of the respondents said, yes, boys are abused when they're recruited as child soldiers. 100% of the respondents said, we don't do anything about it. We don't have the funding for it. We don't have the expertise for it. We don't have the skills to make those interventions. So I think the gaps are huge. Starting with the legal and policy framework, which inform community and attitudes, individual attitudes, the fact that the fabric of society is so torn in these settings makes it very difficult to make interventions. And then overriding everything is the deep stigma, the self-inflicted stigma, and the stigma that victims and survivors also inflict on each other. So these are huge challenges that exist.
Because you're really describing the need also in order to help a person individually, one has practically to go through the community, because it's just in the moment that the community, or even people who have a role in the community, can have different attitude, that the person himself can accept that there is another way of looking at this. And I think personally, as a psychologist working with survivors of torture and especially sexual violence, working with their feeling of how they're degrading themselves is perhaps the biggest thing we can do. The moment that they can look in the mirror and say that I am I and nobody has taken away my dignity. We have managed a lot, but that takes time. But this is where we are heading. Thank you very much, Shadow. Do you want to add something here? Because he said some very challenging things about men, I believe. But please, what do you find in your work in the reform? What are you fighting? What are your mountains?
Yeah, good question. I think, to put it shortly, but could always be expanded a bit more, is that basically making sure that gender is not just equated to women. I think it's something that we work with a lot to make sure that when we are talking there are many reports and many sessions I sit on where they're like, we are using a gender perspective, and then it only talks about women and girls. And I think this is just a problematic tendency that we see, making sure that when we're talking about gender perspectives, we're thinking about men, boys, girls, women, non-binary individuals, and making sure that gender is actually inclusive and recognizing all the different identities that it encompasses. So I think that in many arenas that we work with, and I think specifically in this topic about sexual violence, that one of the most important agendas from the UN is called the Women, Peace and Security Agenda. And with that, there has been work to say that men and boys can also, which is an important, for those of you who aren't familiar with it, basically.
Took some time, is that?
Yes, it took some time, and it took a lot of hard work from a lot of women and a lot of activists to say that women experience specific gender vulnerabilities in war. And now that there is slowly kind of being outed that what are the gender vulnerabilities that men and boys are facing in war. And I find that sometimes when I try and bring this into forums, sometimes within Women, Peace and Security, it can be hard to bring that up, and I understand why, but also that these topics shouldn't just exist in their own silo, and women's issues shouldn't just be in their own silo, but that this should be more an inclusive, I guess, arena to work with, if that makes sense.
Thanks a lot. But yeah.
Yeah, I think I just wanted to touch on healthcare services in particular when we talk about inclusivity, right? Oftentimes in our work, first of all, in the context where we're working, many healthcare systems have already been decimated. I've worked in contexts where there are 7 psychologists, for example, for an entire country. So already the resources are very limited. But then also factor in that particularly for survivors of sexual violence in general, oftentimes there is not the training or even the supplies, the equipment to be able to handle these types of situations. And what we've seen very practically is that often in many countries, because it's just assumed that men and boys don't experience sexual violence, where is the first point of call or the treatment area for survivors of sexual violence? It's in the OBGYN unit. It's in the women's healthcare facility. I've had medical staff tell us when we're going to go do assessments and see how we can support and strengthen care. When a male survivor comes, I have to put him in the hallway because I don't know where else to receive him. I can't take him into the area where women are sitting, where female survivors are. So even thinking about these small aspects, which might seem very small, they actually have a major impact. And I think particularly for humanitarian actors, oftentimes because, our experience and our work is really in emergency environments, to take the time to pause and think about if the way in which you're structuring your response is leaving someone out. And oftentimes for male survivors, the answer is yes.
That's very interesting because in many ways a story repeats itself because we had the same issue with women. For instance, in the wars of former Yugoslavia, we have had people in this room here who have been working in that area, and they couldn't say women raped, they can go this door. I mean, there was no way. It had to be rewritten as it was embroidery class for women, and then happened also to have been raped by war. So now it's happening again, and of course it may be even higher, the problems facing the men, where to go and how to formulate this in a way that it's actually accessible to them. And I think this is where we have to put our heads together and give some advice to those who are in the field, because they are the ones who need it. So thanks a lot. Helen, I'll give you the final word, practically the final word. What would you say would be the most problematic things to
First of all, in many countries, I think children are not seen as a person. They are seen as their parents' property. So they don't have really the children's rights. So that's one big obstacle, and also that it's still invisible in many countries. When we started in Nepal, they said and especially to young boys, they said it's not happening here. Perhaps it's happening in some hotels where tourists are taking advantage of young boys, but not not elsewhere in our society. So I think the awareness that it is happening everywhere in every society, and that's we have to raise the awareness. And I was also in the Ukrainian case that we got. It was also stressed very much how unprotected children are for being abused in the internet, and how many also cases of that it starts as an online association, and in the Ukrainian case it was online and then it was also physical. So I think it's really an obstacle that we don't know what happened with children online.
No, that's a tremendous problem. And I think what you raised, which again, I think underlines so very strongly the need to have a rights perspective, because we're speaking about children's rights, and the children to be respected as a rights holder. So that's also part of the communications that we need to have around the world with those who are working with children. So thank you very much, Ellen. I think our time is up, but we have been discussing the ways that we can work. We will always be very dependent on someone who's willing to support us and to fund us. And I'd want to mention, and I'll come back to that list, we have people in the room who have been very supportive also in making this work possible. And I will thank you again, Les, for especially looking at you here, because you not only have been able to provide funding to the work that we're doing, but also a lot of professional and experiential input to the work, which is very valuable. And others, our board and others who contribute in such a fine way. So that is also very inspirational. So we just must keep on working, and together we're even stronger. And we can work on many different levels, including art, thanks to you. Thank you so much, and thank you all for your attention. And thank you.